So let's take a look at all the treatment options available for treating lower gastrointestinal tract bleeding. All right, treatment for lower GI bleeding. Okay, so we have already spoken about lower GI bleeding, which is bleeding in small intestine, large intestine, down to the sigmoid, the rectum, and the anus region. Okay, so the treatment is usually directed at the cause. Okay, because we have got to establish that sometimes there might be intestinal bleeding, and the cause could be what? It could be due to angiodysplasia. It could be due to colitis, that's inflammation or infections and all of that. Okay, so if you know that there's a secondary cause of the bleeding, you have to now address the cause first, right? So when you address the cause, that's fine. All right, then therapeutic options could include pharmacological, using drugs that are basically what will help for coagulation, or drugs that will basically tackle the inflammation, drugs that will basically tackle the infection, right? Then endoscopy, angiographic, and surgical methods can all be employed, all right? So when bleeding has ceased, this option become preventive, all right? So you can also be doing these options either to prevent or treat the disease condition, all right? So endoscopic treatment include what? Epinephrine injection, sclerotherapy, argon coagulation, bipolar coagulation, endoclips. All right. Angiographic treatment include what? Intra-atrial what? Vasopressin and embolization. Just trying to like clip up the blood vessels that are basically what? Injured, or basically trying to like block the blood, like the blood going out. All right. So these are the various possible causes of what? Lower gastrointestinal tract bleeding. All right. So other treatments will be directed at the underlying condition. So, for example, you could give steroids and immunomodulatory for what? Um, for inflammatory bowel disease, that's IBD. You can give antibiotics if it is what? Infection, like infective colitis. They can do what? Hemorrhoidectomy if you are having what? Hemorrhoids on ground. Okay, so that's it for the possible treatment options for this lower gastrointestinal tract bleeding.